Malama tau te lava mai ki he whiawhaka whaofa koe ni. Ko au Brenda ko ngaika ko e whakahauka tēne tau polokalama ko ia i he whiawhini. Pea me Seattle, Washington, pa pehe whoki me Tonga Eki. Ko e kau whakahauka polokalama ko ia i he whiawhini. Emeline wha New Day. Dr. Ray Ebrahim and Brenda Kongaika. Ko e ko ata taitale lea mo tolu. Pea ko malo e lau maria hoi ki papi he ke tonga mo vulanko toa mo mea mai he whiawhini. Ko e ahua taha e ni. Ai ko tusite eni o September ahua taha e ni mahinani. Ai o tau ofi of ke osko ia mahinani. Tau whiawhia pe, tau mo ilelei, tau whiahanga ki he ope. Ko i ka hame e hoko. Ko iai i he whiawhini u mau i mau polokalama ko ia pea mo e talatala noa i pe ki he mo uilelei. Pea mo e mea o whakalakalaka ki he tau sino o kai kia ha tau lawea o whakasino pe e iahi a whainga mahaki ki tau e hia ki ai. Ko iai o ata tau lotu ke kamata ki tau polokalama ai ko Dr. Ray ni tēne whahoko atu e tau ulaki lotu malo.
Malolele, Tauloto, our Father who art in heaven, hallowed by your name, your Son Jesus, and the Holy Spirit. We come today to pray for you only, God, the true God. We pray for your safe and protect our King in Tonga and protect us. Give us the wisdom as you promise us, the wisdom when we talk and when we be quiet, and when we talk, how we talk, and when we are in silent, how to be in silent. You are the true God, God of the truth. You put the truth in our mind and in our heart and in our tongue. Open our mind to see your wisdom, and for all the people listen to us, give us heal. Whatever they ask for heal, you heal them using our hands and our knowledge. In Jesus' name, you listen to our prayer. Amen.
Amen.
Oni.
Feel
It didn't come through.
Oh,
It's okay. Yeah.
now we're back. Are we okay? We
We're
will.
okay.
Okay.
But we can play it again at the top of the hour, maybe.
Okay.
Yeah.
Okay.
We're back.
Yeah.
And this is
Okay.
our health talk with Dr. Ray, and welcome back, Dr. Ray. And we're
Yeah.
going to just give it back to you to come out and introduce what we are going to talk about tonight, Dr. Ray.
Okay, today we will talk about gout, one of the very common disease in Tonga. Last week we do the introduction about gout and the uric acid, and what is the uric acid and what caused the uric acid. Okay, and just I want to ask the people to follow up what we're doing today, to go and watch our show last week. But in a very brief shortcut, uric acid, it's soluble in water, so people, they need to drink water. This is in the very simple format. Or actually, uric acid can be a rare or first early sign of kidney failure or liver damage. So people to be aware of the uric acid. Today, we'll start talk about gout. We don't have time because today I will talk about gout and other misdiagnosed of disease. Can doctor diagnose it as gout? So I'll talk about the gout and the other different disease, so people will understand what is the symptoms and what the name of other disease and what happened here in Tonga. Okay.
Okay, Brenda, can you translate that? Or go ahead, keep on that. Go ahead, Brenda.
Iyo koe review mai pe Ray tau tanoa koe health talk we ko si whekau aki pe mo uric acid acid tau sino. Pea mo whamanatu mai pe koe tau tanoa koe tau kawing hai pōni mo health talk koe kauti. Pea okune pehe pe ke tau inu vai ke lahi he koe kos lahi ia o uric acid. Koe tae inu vai. Pea ka pau o te aha mea o ku hala me e mirini tānaki ma e koe.
Kaya, ka whamanate taka taka pate mo ki me ato o wakai ke ma program koe wiko osi. Koe vai o kune hanga ko whamo vetei ai. That's a very basic uric acid. Ka pau si Hawaii, aina dau lawe ki ahe wiko osi o toton ke inu ai lita e ua koe nima aho. Pua pau ke toi kai miti pe toi kai hame ai. Pake to ino ki lahiange vai ke whae, li te wha. Ka wai au ni te tautano ke kauti, pea moe ngai mahaki o ku misdiagnosia koe kauti, ka koe koe kauti ai. Dr. Ray, I think we're good on that one. And do you want us to put the PowerPoint up?
Yes, please.
Okay.
And I want everyone to listen and they will surprise.
Okay. That's exciting.
Yeah.
Oh.
Okay. So we have here gout.
Oh my God.
Yeah. This how it looks like. So we go to the second slideshow.
Kaya, koe whainga koe no ku kauti, koe angai no mo sio mai koe ni ki he kauti,
Yeah. Did you put the seconds? Yes. Here, the gout is painful form of arthritis. Okay, and I want to put like 1 million line under arthritis, because sometimes people come to me being diagnosed with gout, but I found them it's a format of other type of arthritis. Usually when your body has extra uric acid, and I'm being under uric acid 1 million too as well, because there's other disease similar with gout, but it's caused by calcium. So it must be uric acid, and it's a form of arthritis. Can you translate this?
Yes. Koe kauti, koe taupehe, koe whahinga peia o taha o arthritis, ka toi fu'u mamahi ange ia, Aia kona winga mai o toi fu'u tōtu ange a uric acid ia I sino. Brenda, ka pāpea me te ke tānak mai ki ai, pa ke tānak mai. Ka kupehe to ta. Ia, ka kupehe to ta wai whahinga o mai ki ai o talatala mai ia koe kauti ka kunehenga ia o toki o ilo I o kai koe kauti ai.
Yeah. So we have 4 stages of the gout progression. So the gout, if someone have a gout disease, it's start from stage 1 all the way to stage 4. It's not between day and night you completely diagnosed with the chronic gout. So we have here stage 1. If you go back, go to the next slide, please. I'll explain to you more.
Koia, oops, sorry. Koe pehe ka e toke tā koe kauti o ku whaka taupehe ku whaka tūnga Ai o kamata me stage 1 o alwike 5
Yeah. So stage 1, go to here. So stage 1 here, you have, we call it a symptomatic gout, which is what is the meaning of the symptomatic gout? You don't have any sign of gout, or no sign, no pain, no symptoms of gout. But how you discover this? When you go to the doctor and the doctor do the blood test, and they found that you have high uric acid, but there is no symptoms all over your body of gout. This is a very quick stage.
Yes, very.
Okay.
Brenda,
Ko ne pehepe o ka taimi o ku ko a symptomatic gout ko stage 1 nia. Pag ne pehepe ka kai taimi na o mai pe tala mai ko kauti. Ka ko taimi ko ne sivi ai ko prognosis ko ne sivi. Not always o ko kauti o kai ke kauti ma pe ai sivi. Kono uhinga pe ia ko lahi uric acid line.
Kaya. Ka whai konga ko stage 1 ko ni ko peka to ta. O kai ka whaka ilonga ia Ka taimi ko o kai ka whaka ilonga ka wanga whewhe ila to ta ai stage 1. O ila he taimi ko ke ale ko sivitoto O kulawa le to ta ia o tala ai kauti me sivitoto. Ka kai ka whaka ilonga ia taha o kuha o kauti ta he foi ulaki stage ia ko ni
Yeah.
Back to you, Dr. Ray.
Stage 2, we call it acute gout. And in terminology, when in medicine or in medical word, when you see acute, it's happened less than 6 months. So the patient will complain about pain less than 6 months. Okay. And this will be the axis of the uric acid start to be formed as a crystal. Okay. And this crystal, it will appear in the space between the joint. So when we have the joint, we have the cartilage and the ligament, and we have the space. So here, the uric acid start in this stage 2 to build up crystal in the space between the joint.
Okay. Ko no wa. O ko acute gout ko taimini ko o me ho ko ya he si he mai na o no Ka taimini ko ne algo uric acid o kamata o hange ha crystal Ka me ko ni hu le mai he baha ko o fanki hui baha hui ko taimini ko stage no wa ya Is this stage starting to have a little pain, Dr. Ray?
Yes. And this can be appear on the X-ray.
Okay. Okay, the ilo I ponga I stage on the wire me time ko ave ko x-ray. Kamata lagi ki mamai ka mana tui o ko ko ni a sisi he mai na ono ai ko kong hono to hono wine ko tau to ngai hono wa ko o kauti Brenda?
So
Oh yeah,
in
you
fact,
got it, Nene.
Okay, thank you.
so in fact, stage 1, that's we discovered by accidentally because there's no
Okay.
pain, no pain. But it's stage 2 when we start to discover, when the people get the acute gout.
Yes. Ai
Okay.
bé ta ta ko stage lagi fa ilo ya pe ya by accident. Ai war pe wa ki me bu ko ka ko ka tai me ko ilo ai ko kauti ya ko ke fu lo ko ya fa ilo ngai ai.
Yeah.
And then we have stage 3. So stage 3, we call it critical gout, sorry.
Intercritical.
Intercritical. Yes.
No, the T actually is silent, so we call it critical. Critical.
Okay. So with a
Intercritical.
silent T, yeah? Okay.
Critical.
Okay.
So it's called critical gout. So the critical gout, here when the patient start to experience pain in a period of time as attack, like he get the attack and then 1 month or 2 weeks, get another attack, then another attack, then another attack. So here start to experience attack after attack. Okay. Here, the uric acid start to continue to build the bloodstream and the joint space, bloating, and the next assault. So what happened here, they start to build the bulk of the crystals. Like stage 2, start to build the crystal. But in stage 3, in critical gout, oh my gosh, I don't know what happened to my tongue today. Okay.
It's
So
okay, Dr. Ray.
in critical gout, usually here, now the pain will be more and comes attack because the blood is already start to build up crystals as a pulp.
Ai ko tunga kan hono to lu ta pe ke tai me we are in critical ai bu silent T ka ko tunga ko ni Brenda oku hai ko ki o mai pe matu watu pe o mai ka stage ko no wa ya oku kamata ken ya o build the uric acid ka ko to lu ya kamata hule ba uric acid ya o ki he halanga to Pea hula ka ke ngai joint paka tai me ko oho ai ko ai kauti o ko uhinga eku mahino ai kauti Brenda ko nga ko poa ka futa to mo fu e kauti paka tai me ka me a fa mama he tai ko oho ai kauti he ko ai ko la ko ai to da o ku oho mai pa se fa mahina pa elele pe he pe ya ka ko hinga ka tu ngai ko ni ku kamata la ke hu uric acid ya ki halanga toto
Okay, so from in critical stage, we go to stage 4. We call it tophaceous gout.
Okay.
Which is
I am
it's
say
chronic gout.
when you spell out the paper as a white tea in critical, I have
intercritical. Like critical.
My tongue is
we're gonna have a medical class tonight, Brenda. I'm
Oh,
the
yeah.
one who can stage on a part I need me.
Yeah. So from critical stage to tophaceous stage. Tophaceous stage, it's the chronic gout, which is mean chronic, the treatment, it will take above 6 months and it's chronic. We call it syndrome. Like sometimes we call it chronic, sometimes we call it syndrome. But this stage is tophaceous. Why we call it tophaceous? Because in this stage, the uric acid start to build tophi. That's why we call it like tophaceous. So in this stage, the gout the uric acid start to be a toffee, this like swollen, okay? Bunions means swelling. So here the joint start to be swollen. Okay,
Wow.
swollen because of the toffee. So the uric acid here start from the crystals to be a toffee. So start to build up like pulp. That's why you see it's start to be swollen and this age.
Okay, I có coi ni có chronic but time ni we got chronic but time ni we got syndrome có stage có ni we got the phases gout aya area có ni alum madina tao kamata ko ulaki hewa built in the crystal kaga tungai ko ni aluya oya ko toffee cái này alo cái toffee ta qua đây cái mẹ cái bunion cái tungan có kamata cái fufu lại còn cái fufu là cái phải vải cái tàu pe cái elbow tôi ni mà cái tay mẹ có qua cái chronic I have chronic Dr. Ray has to be more than 6 months.
We use two terminology, acute and terminology, like acute heart attack. Acute heart attack, it's mean happens suddenly. Okay. So when we use acute, it means it happens suddenly. And why we call it to the patient will start feel it suddenly, because the stage 1 we discovered by accident.
Yeah.
Go to the doctor and suddenly you find yourself have high uric acid, but no symptoms. In stage 2, we call it acute, like you start to feel the pain straight away. But in fact, you have to be in stage 1 and then go to stage 2. You can't jump in stage 2 straight away by yourself.
Right.
Here, the chronic one, the chronic, it means it's up to 6 months and it will be chronic because the treatment will be above 6 months. Very, very hard to treat when it comes to stage 4.
Okay, có cái này cái là cái ta cái cao tí à có phải cái stage 1 pe papuna cái stage 4 ikai có bao cái lagi học cái stage 1 ni apa to cái học cái stage 2 ai cái stage 2 cái acute to tamai học có phải fatu pake cái Brenda cái học có fatu pake có ya có hinga hay có osia uya cái tu nga có fika fa o qua cái tunga có để over có hệ máy nào nó ai có over cái máy nào nó bẻ la vale vậy cái họ có là chronic và cái time mình có cái tunga phải tự tama cái ya phải tana cái Brenda
cái toffee cái time mình có cái toffee
yes cái time mình có cái toffee fika fa cái mà trước tao có mắt tao cái cái crystal
oh yes
cái này alo cái mấy crystal lo bẻ la cái toffee ai cái toffee cái tay mấy có quay cái ai fufu lại tay mấy có fufu lại cái một tu ava cái tu ni mà
I
think this experience with my husband a lot, Dr. Ray. So I deal with the
you have the experience.
Yes.
You know, stage 2 like acute gout, and stage 3 the in critical gout. The medicine here it will be helpful with when the patient understand how to reduce the uric acid, like his diet must to be low in burns. You remember when I talked about it last week? That's why I told the people go to last week to see how to reduce the uric acid.
The uric acid, yes.
Stage 4, that's when like surgery to go. It must be to clean what? To clean the toffee. Okay, because now it starts to be hollow, so we need to do surgery to open to clean the toffee around the joint. Okay, but in stage 4, when we do surgery to clean the toffee, okay, the people must aware for how to reduce the uric acid. And again, during stage 1, stage 2, stage 3, even stage 4, you have to look after your kidney and your liver. Two things. Because
Right.
I'm telling you, uric acid can be an early sign for kidney failure.
Right.
So people
Oh,
who have
no.
gout, it's not like an easy, it's maybe a disease now, but in the future, you will end up with kidney failure or liver damage. So
Yes.
Oh,
it's
yeah.
some disease here. We have disease, but we have a common factor. The common factors here, we have to look for the organs involved to make the uric acid high. And why? We have to investigate. We have 56 months to have a kidney function test and liver function test. These two
Okay.
things, we have to keep our eye open for people they have gout.
Okay. Pakitana ki mape Brenda. Tunga ko no pe he to ta ko ulaki ke tolu. Tunga ko ya fe mai ke kamatele ko ke lili ho fonga kai ho tai eti. Ka
Yes.
ko ne ya wo ke fika fa. Ko tai me ko o ku te ta pe ko pau ke reduce ho uric acid a ko ya. Ai pe to ta fo ke foi programa ko ne wi ke ko si. O to si o ga ngai fonga ko ke fasisi ya ki ko uric acid. Aya na tau lave ko kamata mai. Brenda ko vai ko ne ha
Yes.
solova aki ko laki me kan ha ko solova ko uric acid ko ine vai ke la ye. Ka
Io.
ko ko me stage ulaki ke stage pa. O ko foi me ala la foi o kan la he wa sino. O fu fa amu adoda o fema o ke fai ke to kanga la ya ke ai ko ate pa mo ta ko fwa Ko
Kaya.
me ala ye hua ko ni ke fare paule ke fai to kanga e ki ai. Ka ko tango ko ha wa stage fa ko tango fe ma ko ke fai tafa o na hanga o what do you call why fa le preta o ko fenga ke. Tango no ta fa na hanga bao. Bao e
Oh,
uric
he.
acid. Yes.
Yeah.
Yes.
He.
And
Yeah.
then Dr. Ray, you said there is a common factor. What is the common factor again, if you don't mind?
Okay, people, they don't drink water, enough water.
Okay.
People, they drink alcohol, diabetes, obesity. People, they have high intake in protein, like they
Yeah.
eat a lot. Even people, they follow the vegan diet when they have beans, like white beans, black beans, brown beans, these green beans. All the type of beans, they have this type to elevate your uric acid.
Oh.
Sometimes it comes from the genes.
Okay.
Sometimes come from a sign of kidney failure or liver damage.
Okay. Ako pehe ta ko ai u common factor e patupunga ko ne kauti ai ta pe ko u me ta tau o hoko. Ai ko kakai ko o ko peke lahi bai e na winu. Pe a pahinga ko na winu ko ne alcohol pe na winu pia mo me ko ya. Pe pe ka na to ko na suka. Pe mo na to ko obesity ai ko na fu usino overweight. O kawai pe mo I'm looking at my note here. Pem kawai mo ma kakai ko na vegan diet. He ko nga na kai pini. He ko pini na tau la me ka we ko si penta. Ko
Yes.
pini o ya la ya me ko puree ne. Aya ko
Yes.
puree na ne fatu ko ya ko me kai ko ya ai ko pini la no mata la ne hina la uri uri. Ko ngala ya ko o diet ko kakai ko na vegan ni. O kune whātupu e ai kauti. Ai ko ungahi me an ko une hanga ko o whātupu ko ne ai kaut. Ai lahi ko ai uric acid ko tupai ai
Uric
kauti.
acid. Yeah.
Oh yeah. Oh yeah.
Yeah. And the other thing here, the doctors must think what is behind. Because what happened, in fact, when we study the kidney, they can't filter the whole uric acid from the body. That's why I said we have to keep our eye openers on the kidney. Even if the kidney is high now, but we have to support the kidney during gout treatment. We can't leave the kidney like this because the kidney play like 70% of the rules to get rid of the uric acid. So we need to think why the kidney can't filter the uric acid from the body. You know, it's not like disease. No, you have to think. If you want to prevent the disease, you have to think for the logic of the disease. What caused the disease? Get my idea?
Okay.
Yes.
Yes. Và đồng tâm là bé Brenda gặp bà mẹ hà lại nè. Coi bé tôi ta có tao kidney coi hàng ấy học filter. Kêu tao xin nó cái này ta off coi này uric acid đấy. Và phút phê mà ấy là time có ku stage ulaki cái phá. Time có siêu tôi ta cái cầu đi. Cái mau ấy là support coi này coi tao kidney ấy. Ek tao mai coi peset te fitu noa. Ở ngáo ấy kidney cái hàng cái rid the uric acid đấy. Ayaw fumaw inga au pito perplenge sengawe. Ay ka kini Brenda ko fua ya
Koya.
Koya.
Yes.
Ay hangay ha filter. Au kini hanga ko no o CV ko ni ay ha ko uric acid. Ay ko pe set fit no ay ngawe o kidney ko no get rid the uric acid. Pag fu fema au pito ya ti to kita kini hanga o watch au pito ay mẹ có những cái hàng support the kidney time có những hàng có or treat có ai cao thì
Yeah, you got it, Lini.
Yeah, I want to give you
I
example.
was spent to cái tai bé.
Kau kale ba to kita,
You have a water filter.
Yes.
And suddenly the water come in the tap, it's dirty. What you will think? The filter needs to be cleaned or changed, yeah? That's
yes,
what happens.
we have to change.
The
Yes.
kidney can't filter the uric acid to get rid of the uric acid in our body. So it's kidney. We have to look for the kidney and the liver, because the liver is do the protein metabolism.
Okay. Aya ko phải ta có đồng mai cái hệ tôi ta coi ni I feel ta coi ni vậy mà tôi coi feel ta coi mẹ có CV nè có CV coi vậy coi ta có tàu linh ngay coi vậy feel ta ở cái quán hay u đi ở tu cụ mày ai coi phát ta ya coi tôi ta cái ngáo coi ai kidney kia tàu uric acid và coi phải mẹ ta có phát tàu mày tôi ta có tàu ate. Còn mẹ yêu cũng phê mà uya cái tổ cái ngại yêu biết tôi ate time có ở cũng học quay ở cao gì
Koya.
Yeah. Now the second slide show, we will speak about the gout misdiagnosed. This disease called metatarsal bone pain. If you look to the pink area, this is the metatarsal. So the metatarsal bone, this all the pink area there. This exactly same like gout pain. I have this patient in my clinic. When he come, he's 31 years old. And he told me he's been diagnosed when he's 7 years old from the doctor that's gout. And when I'm always like to go to the scratch and how it's go and how it's come and how it's happened. Because even he told me when he took the gout medication, he started to take the gout medication when he's 7 years old, too young. I asked him, did the doctor do a blood test to see the uric acid? He said yes. And he said the uric acid is Cybe.
Oh.
And okay, so I let him lie down and I've been check with my hand, the toes, where the gout usually to be built. You remember when I said, so they start to be in a space between the joint? And I didn't find I don't feel any crystals. So what I did, I start to press where the metatarsal bone, and he was in mamahilahi. He was screaming to the max. But it took me 1 month treatment and he back to normal.
Oh, wow.
No pain. So this is one of the very common if can be the doctor misdiagnosed. That's why I said the uric acid in the blood must be high. If the uric acid is high, how come it's gout? Maybe it's other disease on the list when we go one by one. But this one here, I have one patient and he's back to normal. And since this time, he never get any pain in his metatarsal bone. So the symptoms, you want to translate this before I go to the symptoms of the metatarsal pain?
Yes. But my God, tao hoko ko gay ka time ko aku tao pe aku highlight ko ono diagnose ko gout aku ya mahaki ko ni pa ngai fa ilong ko ni ko metatarsal bones pain aya ko musio ma pe ke me ko lan pinky aku asia tu pe ai ko ngai hui aku ne hanga ko o fa matala me ko hui ko metatarsal
Eine ulan pinky.
Oh yeah, I know ulan pinky.
Yes.
Pero talano ako ni kene patient ko ni na tao tolo ta. Dr. Ray, how old the guy was starting to take the gout medication?
7 years old.
7 years old? Wow.
Yeah.
Wow. That I don't know.
That's young. I never heard a 7-year-old. Yeah.
Take gout medication ni iheta o hono fitu. But I'm gonna have I go get Dr. Ray. I had Dr. Ray or CVP uric acid. But also the CVP get uric acid. But I had or lomi him going to metatarsal bone. Pero time ko na hangay ko lomi ko hui ko ni ko mamahila ya tu ay oy awe agito ta ko ni pero ko hui ko hangay ko fa mai au ni ko agito ta ko ni na kamata pen tau fito ne take gout medication ni ka ko na iloi o ikai ko gout dia ka ko mahalo ya ki fe fini ko metatarsal ay ko lang ay hui ko ni o asia ko lanu pinky
Yeah. So this patient, when he took the gout medication, it doesn't work with him because it's not gout, it's metatarsal bone. So the symptoms of the metatarsal bone pain, you have sharp aching or burning pain in the ball of your foot. Okay.
Wow.
The part of the silo, like the bottom of your foot, just behind your toes. Pain that worsens when you stand, run, flex your feet, or walk, especially when you walk like with no shoes or slippers, we call barefoot.
Yeah.
And a hard surface and improves when you rest. And I ask him, when you rest, how's the pain? No mamahi. When you stand up, very mamahi lai. When you walk, very mamahi lai. And the foot swollen. If he rests, there is no swelling. See how you go from disease to disease. But if you look for the symptoms here, even sharp or shooting pain, numbness, or tingling in your toes. And the people, they have the gout, they will complain about the toes. You get the idea how it's very, like you feel like it's one line between the metatarsal bones and the gout for the symptoms. And especially Emeline, because her husband have gout, so she can tell us how it's a very thin line between the gout and the metatarsal bone.
Coi ngay phải lo coi này metatarsal bone ai bé phải cái này có coi cao tiền ní cao ikai coi cao tiền ní ai cái sharp cái tay mẹ có tao bé có mahoka coi ní Brenda cái langa cái tay ní bevela bevela Pero wa pe ke tu nga oku anga shooting pain anga ko lang ako mahoka baka tau le to ngai ko kiai pe mo numbness pa anga ko kamata ke mamate pe apa ke tu nga tingling anga ko very kata ai ngai ko ulu tu buai ko mo se mai pe ki ko ngai fa ilong ai nia o wai fa ngai na pe na to ria ko kau tie ni Kau kai kai kau ti à, hẹp mấy ta tao cái phải long à, coi ni phải long à kau ti, kau kai kai kau ti ni à, kau coi má kia coi ni hui coi metatarsal, coi phải lang kia ai hui coi ai ni op asset coi ni bulan pinky, kau pati museo mai peki ai, kau coi mama ya tu
Okay. Any questions so far or so clear?
I think, Brenda, if you need to add something that I missed, I appreciate
No, I want
that,
to ask. I want to
sure.
ask Dr. Ray about the fact that, you know, I think my husband had gout at one time, and he said it's like somebody's poking his toes with needles. You know, like
The sharp pain.
sharp pains.
Okay.
Yeah. So I think maybe it's not a gout.
Yeah.
Maybe. And I tell you, wait, this is one disease. Wait till we go to the list of how the doctors can be misdiagnosed gout with this disease.
Yeah,
When you
but
see
let
the
me,
next disease,
Dr. Ray, let me
will-
say one more thing on this one here. I wanted to translate this part here. Ông ta nói là tôi ta coi tay mi có cái tụ quái pe cái lẽ pe hang mà pe lu vai pe ko lui pe ko lui lại vậy. Coi tay mi nè coi
Yes.
la hay ai langa ai mà mai. Coi phải lo ngay nè ở metatarsal ở phải coi cao tiền nè. Coi mà mai la hay to pito Kagu improve time ko ke ki tango tu fa malolo
Ay og fekau aki, erine, og fekau aki, a mea ko ya mo bone, he, og ne pehe, he.
Yes. Oh yeah.
Oh.
Mà tôi có hui ni hui cái metatarsal ai có hui cái acid lumpinki og hui cái metatarsal hui ko ya Kagu ke cái time ko ke tao pe ke tu pe ke lere pe ke lue pe ma pelu ho ba pe ke lue ta su ko ngai me ai ni ko ka time ko ke tangu tu fa ko ki ba lo to kula ba ngai ai ko ngai fa ilong ngai ne ko ngai symptom yes ko ngai fa ilong ngai ni oh yes o metatarsal bone pain o kai ko kau tie ni ko me ko fa ma fa ni fa fini o biai kau ti pe biai mo me o gui ko Saya ni no pe na to ko kauti ka ko metatarsal bone pain dia
Yeah.
Back to you, Dr. Ray. I think unless if Brenda add something.
No, I'm good.
Okay.
Okay.
Now,
Thank you.
the second misdiagnosed.
Okay.
You got it? Yeah.
Yes.
We call it pseudo gout. P silent, okay? So it's a pseudo gout.
Right. Like pseudo
Like
gout,
the
right?
Pseudo,
P
huh?
silent,
Yes.
the P is silent, so it's pseudo gout. The difference between gout and the pseudo gout, because I have a lot of patients come with pseudo gout being diagnosed as gout. What is the difference? Gout caused by high uric acid. Pseudo gout is caused by calcium phosphate. See how is the difference of the causes? And I ask the people, did the doctor do the blood test? Yes, how's the uric acid? Uric acid is Cy-B. But the doctor said the uric, sometimes you have the gout even if the uric acid is Cy-B. This is not applicable. So we have the pseudo gout, same symptom, but caused by calcium. Gout caused by uric acid, which is one of the main symptoms of people they have pseudo gout, numbness, mamatic on the hand and foot. Okay, same but different. Same in pain, swelling, stiffness, worms in the large joint, and most commonly affect the knees, but can also be affect the ankles, worse. So people here is not complain about the toes, about the fingers. They complain about the knee or ankle or shoulders, hands, okay? And the attacks can be sudden. Symptoms may be last for days or weeks.
Okay.
CD gout, joint injury or surgery or trauma can cause joint cartilage, like cartilage, to damage the cartilage and the calcium start to build.
Clear.
The people, because of the calcium, they will have high blood pressure. Because calcium can cause high blood pressure and can cause irregular heartbeat, can cause heart failure too as well.
Wow.
You talk about this.
Okay. How could go any ke mahaki go any? Because pseudo gout. I go. This reminds me in the computer. But going I for a long ago pseudo gout. Tamboy. How to fight ke go be gouty. Ako natatao pera wake na fight ke ngai fa ilonga ya. Kako na kai ke he ni. Ko gouty. Og tupu ia fa tupu ngai he uric acid. Ko pseudo gout. Og fa tupu ngai he fulai ko calcium. Ko lai ko calcium ko he sino. E la vai ke tupu ai toto malunga. Pa la vai ke tupu ai irregular ko ni ai taho mafu. Kako ngai fa ilonga. Og tatao pe ai oku as elanga pe ki fufula pe tau pe pe ku what's the stiffness in Tonga, Brenda? I'm trying to come up with the word.
Whawhewheka.
Yes, ai aku whawhewheka pe ko ngai symptomia ko o sura kau pa mo kau tif na tatau pe na wa. Ka kono fai ke he pe ko kau ti o fa tupu uric acid. Kako sura kauti o patupu e calcium kako no me ko time ko oku o hofiai oku me tau pe ia pe hofika e kauti ko me ko ke tau iloi ka oku ikai ko kauti ni o te fa o mai to ta ko mahaki ko ni ai sura kaut o ikai ko kauti Ikai,
Peterini. You're doing good, man.
Okay. So what happens when you ask the doctor, and the patient must be clear. When we do the blood test, the uric acid is high big to do the calcium. Okay, and the main time we have clinical patient assessment. So simple question: did you feel warm around the swollen joint, like the knee, the elbow, the shoulder?
Right.
If he, yes. Okay, because sometimes why the doctor asks the patient a lot of questions, because there is a lot of disease similar to each other. And this, oh my gosh, 2 days ago, sorry, not 2 days ago, was Friday, last Friday, patient come. Each question I asked, I don't know, I don't know, I don't know. Then I told him, so I'm asking you or I'm asking someone else? You have to be specific, because each question I ask, he don't know. So I said, it's your body, mate. It's not my body. And whatever I ask you, it's you. So you have to answer me. You got it? And I surprised when his wife, she gave me the answer instead of him, because he don't know. And his wife keep reminding him. Oh, but you know, that's how it should be. The doctor must ask and ask and ask, like investigator, till he found, because each answer you will tell the doctor, it can take you from one disease to the other disease. And if you look here, how it's all the disease, we have the metatarsal and we have the gout. It looks like
the same.
very similar to each other. So you have to be specific for your answer to the doctor.
Kaya, kaya me ako na blabi ko kaya Dr. Ray ko tayo pe hui ko na eke ko kito tayo ko ne ma ko su gout pe ne ke hoi pe ma fan na au ngai hoko tanga hui he ka su gout dia e lave ke ne ke au ki ho tu inima pe mo hoko tanga ni ma pe mo au ki ho uma pe mohoni mai ka gumana toi o ku pehe to kita ko pau ke ne hanga ia o eke ngai fehui he ko fonga be tene I loi go ai fai ke ko ni o kauti pe moe misdiagnosed kon ko o mahaki o I kai ko kauti ai ko mahaki ulaki na tau laki lave mai kai ko metatarsal pe ko hono wine ko gout ai ko foi mahaki ko ni o ku me tatau pe hona fa ilonga na toria pa moe kauti ka aku nau ke hepe ai kona ke hanga ko lave ke ani nai ko kauti o fatupunga uric acid ka ko kauti o tupia me lahi ko ai calciumi I ho sino ka ko time ko lahi calciumi he sino o tupai to toma alunga o tupai mo ta ko ni ai mafu o I ko ke tonu irregular ko ai ta ai mafu ka buange ko la ko to ke ta rei ko ta ha fe ho ko une eke ko ki to ta ko ni ne mai gout pe mama fana ai ho ngai ho tanga hui ko fe hui ko pau ke fai fe hui lahi au pito ia ke I loa e fai ke he o mahaki ko ni back to you Dr. Ray unless if Brenda add something
So
No, you're good. You're good.
for the gout, the main cause the calcium. Yes.
yes
Okay. So what caused the calcium to be high in your body? Number one, vitamin D deficiency. So when you are low in vitamin D, the calcium is high. That's number
okay
one.
okay
So we have to look what's behind. So vitamin D, it will be involved for the treatment for gout. Number two, you remember when I said the uric acid, it's maybe the early sign of kidney failure because the kidney can't filter the uric acid?
yes
With the calcium here, we have the parathyroid. So the parathyroid plays around 90% to the calcium level in your body. So definitely you will have parathyroid issue, which is now I will ask the patient, one of my questions. Did you have trouble falling asleep? Did you have headache? Did you have numb in your hand and foot? Did you have mood swing? I need to confirm because the end of the day, when it's come to the calcium, what caused the calcium? Do you have high blood pressure? All these questions to confirm, because sometimes if you treat the calcium, the blood pressure will go down. Okay.
okay
So when it comes to gout, again, we look what behind the disease. It's a calcium. So as a doctor here, we think of two, vitamin D and the parathyroid. That's the plain rules for the calcium.
okay ko suru kauti kono tupu anga ko calciumi ka ko fe I leva ko ha me une fa tupunga ai malunga ko calciumi give me a minute here ko ulaki ko hinga ulaki ko malunga calciumi he sino ko sisi ko vitamin D I ho sino ai ko deficiency pe vitamin D ko kamata ke malunga ho calciumi pe ko fika wa leva ko parathyroid ko ke ma po ko hai ma haki ko ni Brenda but pe ko leva ngai fe hu I o eke to ta ai ko ta ko ngai fe hu I ko eke to ta pe ko ke mood swing pe ma we high blood pressure ko fe hu ya ko ne hanga ko o eke ko kena I loi ko pe maalunga ai calciumi matui ko sudo kauti o fa tupu ia he maalunga calciumi ka ko calciumi ko ha o kune tu fa tupu ai maalunga calciumi ko fika ulagi ko sisi e vitamin D ho sino pe fika wa pe parathyroid pa mahalo Brenda ko fa ka ke thyroid ko ke I'm not sure about the parathyroid, but I think Dr. Ray can explain that a little bit more detail to us later, Dr. Ray, yeah?
No, okay.
Dr. Ray, so people, I just want to know to let them know how to increase vitamin D in their bodies, like drink a lot of milk. Do they have to take supplement?
With this stage supplement, like people with gout, I gave them 200,000 units a week.
Vitamins,
Vitamin D.
vitamin D.
Like every day, if you found, you'd be like 50,000 units a day of vitamin D to get rid of the attack of the gout.
Wow. Okay.
Okay, ko tunga ko ni ogu yai ko suru kautia. O fema ole vaya ke kamatangawe ke supplement ke vitamin D. Ko unit. Is this the Australian guideline, Dr. Ray? So I got unit and ni mamano or vitamin D aho.
Okay.
Or
The
is that
FDA,
50,000?
okay, no, wait. The FDA and the Australian New Zealand guideline, when we have the recommended daily intake, it's 1,000 units. That's the guideline for all. When we talk about the gout, here they leave it to the doctor.
Okay.
You can have 200,000 a shot, like injection. You can have 1 million injection, 1 million unit. It depends about here, the doctor, we call therapeutic doses. So the therapeutic doses that's come to the doctor, which is here in Tonga, Egypt, I use the injection. Even Australia, they use the injection because when the people, they need the whole shot straight away, rather to have tablets every day. But here, what we have available, the 50,000 units. So the 50,000 units, sometime I told the people, the patient, take 50,000 units a day, okay? Because I want to increase vitamin D to low the calcium level, especially in gout. For the parathyroid, the difference between the thyroid and the parathyroid. The thyroid, this, can you put the camera?
The neck, something in the neck.
Okay, we're gonna put the camera back here.
Right.
But Dr. Ray, before you go to parathyroid, let me translate what you just mentioned. Ketua kon kau biar kau sudah kau ti, opera mai tu daya, firma lama ke huku kita ai vitamin D, ayah ko unity awak ke wakilu, pe ko what ko me ko ma ko itong ata ni mi ko ni mama noe ai unity. Kau ti pen pe me sio ka eto kita ki sudah kau ti, mo hai fie mau. Ko fongan ko can hanga reduce he babeta can hanga to wifo ai maalunga ko ai calcium ihe sino ai ko foi me ko ya depend le me to ta en sio ko hai fie ma ko vitamin D ke sino to ta ko ni pe ten hanga le ba fu ai hu ko vitamin D ten wan ke to ta ko ni ka ko guideline ko FDA ko 1000 ka ma to ko unit ko ni mamano pe ko 1 kilo ko firma uya faka ahoy he ahopeta hai itu ako wa ke suru kaute back to you, Dr. Ray.
Interesting.
Yes.
That's why here a lot of people in Tonga, when they go overseas, the doctor tell them, well, you shouldn't take gout medication.
Yes.
Because it's a gout, not gout. And again, what happened here? When people drinking kava, it's actually come to the liver, number 1, and that will affect the vitamin D3. Number 2, we have the ground of the island. It's full of calcium. So the food here is rich of calcium, which is a lot of people come with gout, not gout. I'm telling you. When we talk about the parathyroid, one of the symptoms, you know, the people, this is,
I'm having that, Dr. Ray.
When they talk like this.
Oh, I see.
What happened? We have here the thyroid, but in the back we call it para because it's the back. So the parathyroid, it's responsible for the calcium level in your body. And that's why you feel like something is stuck in there, and every time, you know?
Okay, I have a...
This is a very common in Tongan people when they talk.
Yes, ai a pe to tai ko tao me kai ta to nga fu ma lu ngai calcium ko me ko bla ai ko ai hai ko calcium ai ko fai long ko para thyroid ko
Parathyroid,
mele
parathyroid.
right Brenda nai na ma ulele pa to thyroid ka ba ke I don't get it right now ka ba para ko nga gi mu ye ai ko
Ia,
ko
e mui.
ko ni
Ia,
me
ko
he kia
thyroid, ko foi,
yeah
ko pat pe ho to monga he. Ka ko alu
Okay.
I loto
so yeah
internal. Eh?
Have an eye. Look here, if I
Okay,
may say, that's the thyroid. But the
okay.
back, that's
Is the para.
parathyroid. So the parathyroid, that's the parts, the back of the thyroid. You got it? That's why we call it
Thyroid is part of the neck, or it's a thing inside the neck,
No. It's a gland
gland.
around the neck. So we have the tonsils. Okay, we started from here. We have the saliva gland
Yeah.
here, the saliva gland, and then we have the tonsils, and then we have the thyroid, and then the back we have the parathyroid.
Okay.
So we start from the saliva gland here. That's the saliva gland, and then the tonsils. So when people they get cold or flu, the doctor put the fingers here to check the tonsils if they're swollen. Okay, under the tonsils we have the thyroid here, and then we have the parathyroid, the back of the thyroid. So we have in here for the thyroid we do TSH and T3 and T4 test. But for the parathyroid we do the PTH, parathyroid, the PTH hormone. So we have the TSH, we have T3, we have T4, and then we have for the parathyroid the PTH or PT hormone that we call PT, but that's P, para, T, thyroid, H, hormone, PTH, like the PTH here in Tonga. Every time I go through,
No
that's
PhD.
parathyroid hormone, parathyroid hormone, parathyroid hormone.
I have a parathyroid hormone I have PTH
Yes.
I have kamata me tau clan ko whawai pe hao ko tau tanso pe hao ko lewa kai a parathyroid I ki moia I ki
The
moia
thyroid. Yeah.
yeah so I think we should be good with that because you explained it better than we tried to do, Dr. Ray. So we're not going to try to translate this part of it.
We have no Tongan word for that.
Yes.
Okay. What I meant here, we have here a very thin line, one uric acid, one calcium, but both the same symptoms, The different, the warmth and the calcium, and the people will come like pain, mamate on the hand and foot. Even sometimes people come with mamate on the hand and foot. That's because of the calcium. So the high calcium here can be an early stage that you will have the pseudo gout.
Oh.
I have a to da ko fai longa ko ni o sort of gout ko tonga ko mamate I have ko le pa tam ne ma o me ko ya ko lucky early stage ya o sort of gout Dr. Ray, I know you mentioned something, Tonga, the food is high in calcium. Can you name some of the food high in calcium in Tonga?
Oh, look, I tell you, the soil high in calcium.
Okay.
If you have anything being planted here, okay, you have the seafood, all the type of seafood, the seaweed, like limo.
Okay.
There's all this high in calcium. If you have tomatoes, because the soil, it's implant in here. So you have the tomatoes, you have the eggs, you have the milk, you have the seafood, and actually all the vegetables all the vegetables, because the soil is, and that's where the roots take the minerals. You know, the roots of any plant take the minerals from the soil. So whatever in the soil, they take it up.
Ko mea ko ku fu malunga ta I he calcium ko I Tonga ko kere a Tonga. Ai ka mea ko ta pe to he kere ko si hai a bit pe he calcium I. Pe ka wa tai mo ka to u mea kai tahi. Ka wai mo ta limu. Pe mo te mata pe mo fai mo. So ko u mea kai ko I Tonga ko malunga ko calcium he ko no inga ko ta kere ko tu pu ko ta kere. Yeah, I think we got that translated, Dr. Ray. So now people will have a list of all. So the key to this one, Dr. Ray, is don't overeat. You know, have a little portion, huh?
Yeah, little
Just
thing from
watch
everything.
what you're eating.
Yes.
Yeah.
But again, you know, it's very common here, even in the church when the pastor is preaching. And then the people, you know, when you do the prayer and suddenly you hear like, you know, during the prayer. So once the pastor in the church, he found the whole church all the way back. You know?
What do you call that one? Ripple effects. Ripple effects. But anyway, okay, hey, talk it down. Có phải lo có nhiều malung ako calcium ko tao sino. Có tán bộ tao mele ấy.
Có huy còn mele.
Có tán bộ tao mele ấy. Mà tao phải có cái phá ta mà phải có tao kia. Tao kia hay tao bé. Có phá nó phải có tao ta của bé. Có hàng nghe có phải mai vitamin D cái. Dr. Ray, I just said, when you hear someone like that, like myself, so I need vitamin D. I'm lack of vitamin D right now.
Yeah. But remember, if you start to get joint pain, okay, that would be gout, stage 1. Because gout, we have stages, okay?
Okay.
You want to go for a break or we continue to the slideshow?
Yes.
Oh, okay.
Yes, and before we go back to the slideshow, go back ahead, may I tempo filang ake o hokotanga hui. Pag ilo le ko ke kamata ke ma ko sudo kaute.
Yes.
Tempo filang ake hokotanga hui. Okay, let's go back to this slide.
Wow, thank you, doctor.
Yo, malo.
Okay.
Very good.
So we're going to the next one,
Yo.
Whoa.
Wow.
Okay, here, remember we said gout, it's format of arthritis.
Right.
You remember my word. So we have here septic arthritis, infected joint. This can be misdiagnosed as gout, but in fact, it's septic arthritis. Remember, gout is format of arthritis. But what is the septic arthritis?
What is the top one? What is it? The knee?
Yeah, that's the knee, and you will see it's like reddish.
Yes.
And down one, the fingers.
Wow.
And even it looks like gout, but it's not gout.
Yes. Dr. Ray, let me translate this part. Matina daw kamata may opehe heto ta ko kauti ko konga peia o mahaki kon ko arthritis I daw hoko may lewain ke hokot ko ni ko septic arthritis I ko taimin ko infected I hokotanga hui pa ko ngai pa ilong ai ni o septic arthritis Ay katahay na bahagi ko o kung misdiagnosed ko kikauti
Yeah.
Okay. So what happened here? Look to the symptoms. Severe joint pain, usually in just one joint.
Yes.
Okay. What happened? Because here I have a lot of people come to me. We have gout. Show me. When I look, it's just one, like one toe, and the rest nothing. So he complained only in one joint. See here, severe joint pain, usually in just one joint,
Correct.
and start suddenly,
Correct.
swelling around the joint, and the skin color around the joint changed, and feeling generally unwell, and have a high temperature, like fever, and he feel hot and shivery. See the difference?
Yes,
Okay.
Dr. Ray, because you know what, I see this one happened to my husband one time, and this one, because septic uveitis, ko ono pa ilonga, ko ulagi ko taimin ko hulangai ko tau pe ai hui, ka ku hoko pe nia kia fo I wha I pe e taha, ko fo I mea mahu I ngā ia. Hoko pe nia ai musio mai ke tā koe ni, ko tui pa ke hoko pa ke langa, pa ke fufula I alo ua, ka ko foi tui pe taha fufula koe ni, pe o ku hoko whatu pa ke ia. Pe ka ke ngata hene fufula, pe o te ririwe kala koe koe o e, tau sia mai pe ke ulanu me kulo kula atu, pe a ku ongo lewa tō tahe koe ni o pai ke ongo I sai, pe ku kamata le ke mofi, pe a ule ongo lewa o ku hange koe nko o ku
Whamomo.
whamomo ko whamomo ko ia, whamomo sia Brenda ko ia.
So the people here, people with gout, they don't feel like hot, they don't feel shivering, but these people, they feel shivering. But if it's not treated, it will come from joint to joint to joint to joint, like when you see in the lady down photo there in the hand.
Oh,
Right.
And if you look to her hand, you will see straight away that's a gout, but it's not gout.
oh, wow.
Ai ka benga to ta ka pau e kai ki fai to o e nia ai septic uveitis e alu me ho ka ta hu e ta ge ho kwa tu ba ho ka tu o ngai ka museo ma ke fa ta ko ni lalo ke ni ma ko ni e fine iki ko ni o ku o si a se pe hange ko kauti ka kauti a septic uveitis ya
Yeah, I have a friend, Dr. Ray. He's like that, but all his fingers. He works for the airlines. All his fingers are all bended in different ways, and so when he shake your hand, it's just he just close his hands and have you because he doesn't want to spread his fingers because it shows that.
Yeah, like he feels shy to do it.
Yeah.
But any redness, like any skin color change on his hand, because this in gout, there is no color change. You don't get any redness or color change of the skin. But with the septic uveitis, you get color change on the skin. That's why one of the main question you have to ask, the doctor must ask the patient, did any skin color change? Did you feel hot, shivering? This, because you can see so far all the diseases, you feel like it's come to similar to each other.
Yeah.
And that's how it's easy for the doctor to misdiagnose you.
Yeah, he said it's arthritis. But for me to ask anything else, I already felt bad that he has that, but
Okay.
Ai ka ta ngai fai longa kon ni da la ko Dr. Ray ko ke septic uveitis ko ta ngai fe hui ko ne e ke pe ki fa mo sia ai ko ta e fai longa ko ne septic uveitis ko ngo e ko te ngo sai pa ko ke ma lunga ho
temperature.
Okay, temperature ai ko fu vela sino pe ko fa mo sia ko ta e fai longa o septic uveitis Pero peliliu pe ko ni kapag kisyo ko kange ko fufula ko ni kuliliu e kala ko ni. Pa ke ho ko ia ke o tui lo ka ho ko pe ke tui pe ta Kalau ta ki fa mama fa et pe o fa longa ko ni o septic uveitis
Ko ia. Wow.
Okay.
Back to you,
Now,
Dr. Ray.
any question in this disease or Saibe?
Saibe.
I think Saibe this is, but my question, Dr. Ray. So if this one was treated, it could have moved to the other knee, is that right? Because I think that's what happened with it lasted a few days on the other knee, and then all of a sudden it moved to the other knee. You know what I'm saying? So is that gonna happen like sometimes?
Okay, let me tell you, all the format of arthritis, that's caused by uric acid. But the difference here, the crystal and the toffee.
The toffee and the crystal, okay.
The toffee is different. So the toffee in gout is different than the septic arthritis. Even both of them caused by uric acid. But the difference here is the changes. The color, it will be from this knee, then jump to the other knee, or always come in one knee. But you can see when the color change like red, that's septic arthritis, not a gout. So main thing here, the skin color around the joint change. If the skin color still the same, that's mean not septic arthritis. You get the idea? I'm talking here.
Yes.
Why I put here the skin color? Because the skin color, one of the main factors for to diagnose patient to septic arthritis or to gout. And even the second one here, temperature and feel hot and shivery. That's why when the doctor asks that question to the patient, oh my, you know, if you come to my clinic, you can say, I can spend half an hour asking questions and I need to get clear information. And all my patients, they told me they never ask all these questions.
Oh.
Okay, cái phố háo cái này tôi ta rei ở bên eke ngày về hui pha au lili ki ko inga ke ilo ai tupunga ko ni o mahaki ka ko mahaki ko ni ko septic arthritis ko ulaki fa ilonga ko ni pe ko o mahaki ko ni ko liliu ko ni ai kala ko ni hotokiri hange pe museo mai ko ke fufula tu pa ko lan pula kapag ka liliw ay kalaya o kay ko septic arthritis ay ko raki excuse me tefito o symptom o mahaki ko ni ko liliw ko ni ay kala ko host hokiri and I think I just want to emphasize the main factor of septic arthritis is the color of the skin but my question, Dr. Ray, so the septic arthritis is the cause is uric acid, did you say?
Yes.
Okay. Ayan ko septic arthritis tupunga penya may uric acid, eh? Back to you, Dr. Ray. Unless your friend want to add something.
No, it just like I'm just in awe because, you know, I was never aware of all these things that could happen to us, our knees, our joints, our, oh gosh, our fingers. Oh my goodness. Whoa.
Isn't it amazing? It all come down to diet, eh?
And to be knowledgeable to what he's saying about the symptoms.
Are we on the last slide, Dr. Ray, or we go next?
No. Wait, come to the second one.
Okay.
You have more surprise. I'm not finished.
Oh, whoa. This is the one that I heard about this many times.
Oh, rheumatic arthritis.
Rheumatoid arthritis. The shortcut is RA.
Yeah, okay. RA.
Here, again, it's not septic arthritis, it's not gout, but it's rheumatoid. Here, or aching in more than one.
Okay.
Wow.
Stiffness in more than one joint. See the difference between the septic and the rheumatoid?
Yes, I can see the difference now.
Swelling in more than
weight loss.
The same symptoms on both sides of the body, such as both hand or both knee. So you get the pain in both sides, both knee. Not like your husband, sometimes here, sometimes there. No,
Right.
it's come both sides and all joints. Okay.
Okay. Go ahead.
Here, other thing, weight
Go.
loss.
We can't see that picture, but that's okay.
What picture?
Brenda, we're seeing it. Are you sure? Maybe adjust your screen.
Can you see the photos of the hand?
Yeah,
Yeah,
I do see it.
I
on,
got it.
Okay, thank you. Go ahead, Dr. Ray, sorry.
But here, what happened here? The patient will start to feel weight loss. See weight loss here. You can see weight loss in gout. You can see loss weight in septic arthritis, but he still get fever like septic arthritis. But he's feel here fatigue, tiredness, and weakness.
Wow.
See the 1, 2, 3, 4. You can see septic one joint, one. Here more than one. Okay. See how it's.
Okay.
That's why the doctors ask and ask and ask. That's
The
called
question,
patient assessment in the clinic.
Ko hinga ko ku fe ma ko ke e ke ko ngai te
Wow.
wi he to ke ta. Ko hinga ko hono fai ke ko ni ko ho ko ni ko rheumatoid arthritis ai ko wi ko RA. Ko hono ngai fa ilonga en ai mo si mai ko ni ko langa pe ko fe langa ki o kai ko foi ho ko tanga hui pe ta. Ai me ka to ho ko tanga hui pe ho ko ai ngai ko ndo ku fe fe ka. Pe tau pehe koe ni ka pa e hoko ni ki he tui, e hoko lo wai ki he ho tui, Ka koe ke he koe o septic ma rheumatoid, o koe ni e lava ke lose weight,
Yeah.
Pe kawadai mai mofi, pe kawadai mai ongo sia mo hela ia, pe kawadai mai bai bai ai. Koe ngai wha i longa in koe o rheumatoid. Ka mana tui o hoko inia o i kai ke fo i hoko tanga hui pe tahe, ka ku lahi ang Hai ko mo sio mai koe o asiat koe ni, e lava pe ke hoko kotoa he ni maa kotoa So, kono whai ke hia koe o rheumatoid, pe a mo septic Batui na tau lavi koe ke septic e hoko pe ke tui e taha Ka koe ni e lava ke hoko ke tui lo wai. Back to you, Dr. Ray.
Yeah. So any questions about this disease or jump to the another one?
Yeah, go ahead.
Okay.
Okay, go to the other one. Yup. Here,
Yeah, oh my gosh.
psoriatic arthritis.
Oh, wow.
I have patient yesterday come to my clinic and he showed to me his knee like this, his elbow, okay, all his joint like this, like his knee. And he told me, they told him he get fungus and he tried a lot of treatment and then, and he told me, but suddenly my body swollen and disappear. And when my body swollen, I start to feel like shorten of breathing and my joint is swollen. And then when it's not, I still have this type of, but they told him it's unknown germ. But in fact, when he come to me, I told him, no, it's psoriatic arthritis.
Arthritis.
What happened here? Joint pain, stiffness, and swelling are the main sign and symptom of psoriatic arthritis. For example, he was complaining sometimes his eyes swollen. The doctor sometimes give him antihistamine, like allergic. It's not work. The swelling from his eye can go to the other eye, can go to all his body. You get the idea? So
Yeah.
here, swelling are the main sign and the symptoms of the psoriatic arthritis. And also you can see the knee. It's not fungus, it's not bacteria. But the fingers and the whole body can be swollen like the fingers you see. That's
Wow.
when the thoracic attack can be swollen on all his body, all around the eye. You got it. It's not allergy. But when I looked to his knee and his alpha, I said, oh my gosh, that's thoracic. Have you heard about this? He said, no. Can you imagine what happened here? Just from the photos. And the way he said, I have his, all the patients come to me, I have the record. And for me, I surprised. No one looked to his skin, like to his knee, to his joint, to be like this. And how come the doctor said it's a germ or bacteria or fungus? And in fact, you look, this is a called diagnosis by your eye as your clinical, if you have the experience.
You're right. You're right, Dr. Ray.
And you know, it's so dry, so itchy. But this is thoracic authorized.
Wow. Ko hoko tu ko ini ki mahaki ko ini o fa misdiagnosed pe ko fa mauhala ia ko kauti ko psoriatic arthritis. Kono te fito I fa ilonga ko filanga ke hoko tanga hui pe fefeka stiffness pe ko fufula ha fa hinga ta fa ki pe o sino ela va pe ke fufula I mata Kako museo mai ke whatata ko o ku Asia tu. Ka kunehanga ia affect ai konga ho tau sino o kawai ai to ulu I tuhu o to nima. Pe ko au ki spine Aya ko arthritis ko nia o ku whainga ta whaaki pe sino ia ka ko mea ko ku hoko. Ai ko ne lauka ni nai. Ko konga ko hono ilo iko ia ai umahaki ko ni ko ne eke ko fehui o ne hanga fa fehu ye to ta ko no puke ke winga ha ko ngai symptom ko ni na me va ofipe ka ku ke hepe Brenda o me va ofipe ya ka ku wai pe aki me eke he hange ko ne lave ko ane nai ko ki he Septiki o ku riliwe kiri Kako hawi ke sudo kautia o ku hoko ke feitu ke hoto sino Kako nia aya ko foi me ala he tolu ko ni ko filanga ki ho tanga hui ka mo stiffness mo swelling ko foi ko laki ko ngai foi main fa ilonga ya ko o mahaki ko psoriatic arthritis
Yeah. So what
Dr.
happened?
Dr. Ray, I have a question before you go on. So psoriatic arthritis, you're talking. This is relatively close to psoriasis, like it's itchy, and then people scratch, and then it's thicken up the skin, or I don't know.
No, actually, it will affect the joint area, like your knee, your elbow, the eyebrow.
Oh.
But it's a swelling. The main thing here, it make your body swollen. Like when you look to the patient here, his hand, that all his body can be swollen like this during the attack. After the attack, his body side B, but still have this type on his joint of the skin. Very itchy and burning.
Oh.
Ko te fito o mahaki ko ni ko fe fulai Brenda
Yes.
Ko se mai peke ni ma ko fe o fula ko to ate ai ulu tuhu pe o ke tui ai ko fe me ma ke he ko mahaki ko ni ko fe fulai
Yes.
This patient, he told me that he went to Fiji and he done a lot of tests there. The doctor in Fiji said it's a germ and it's not be treatable. Like here, and I told him, you know, we are different theory. and I study the medicine on the other side of the world, so don't worry.
Dr. Ray, I only have to say something here to let you know. But the information that you provided to us every week, it has to be a medical doctor. You can't like the people claiming on Facebook. You know what I'm saying, Dr. Ray? Because this is a lot of information that only a medical doctor can come out with this information, and it can only apply to common sense, you know? So, I mean, Brenda and I don't have to have a PhD or, you know, in order for us to look at your work right now, Dr. Ray. And I have to credit you for this one. And I have to thank you for coming every week and helping us to identify all these diseases that always misdiagnosed for gout. That's all I wanted to say, Dr. Ray.
Malo, Peter. Malo,
You're
Peter.
welcome.
But you know what here? Patient is suffer and then end up it's unknown disease. Unknown germ cause his body swelling suddenly and grow suddenly and cause this type of skin in his joint. And when I looked at him, man, this is psoriatic. And he was surprised. But anyhow, I started and he's supposed to come tomorrow for the follow-up, which is I'm waiting to see the result of him. Just in 2 days treatment.
Did you say this patient went to Fiji and they told him that he had germ instead of
yeah,
psoriatic?
instead of psoriatic, yeah.
Okay.
Maybe he was an ear doctor.
Okay. For those of you who are there who are questioning Dr. Ray's what do you call the credentials, I wanted to say tonight, a patient of his went to Fiji and then diagnosed with some germ, but it's a psoriatic arthritis. So back to you, Dr. Ray.
Yeah. Okay, we go to we have 2 diseases left.
Okay.
Bacterial.
Oh.
This one here, we call it cellulitis, like cell.
Yeah.
Yes.
Okay, so what happened here? That skin infection by bacteria. Suddenly, the foot swollen and red and mamahilahi.
Akili, yeah? Yes.
Oh, wow.
Wow. And the joint will be swollen like you can see here. And then the doctor can easily say, that's a gout. But no, it's not. Okay. So here, the patient will have very painful in the skin. If you touch his skin, he will be very painful. And even the feeling, you feel like hot and swollen, red. Looks red.
Yeah. Katahan e mahaki ko o fa misdiagnose ki kauti. Kutau ki hokot be ko cellulitis o kui ko cellulitis. Aya ko bacterial skin infection. Ai kono ai fa ilonga pe na museo mai ko mama hi kiri. Pe ange ko vela pe fufula ka ku fa kula.
Tangilangila.
Tangilangila. That's right. That's the right word. Thank you, Brenda. I have ako hangin ko ka hangata magi Brenda hangko ka mai ko hangata blister
Yes.
Pe fufula au pito ka ko ai ko tu anima
Oh yeah.
Yeah, ta pe fulai ai ngai ululu tu pe ko tu anima. Ai mo se ma pe ki fata ta ko ni ko pe he to ta o ku fu fa hui na to la ko kaut ka ko kautia ko ma ke ko ni ko cellulitis. My question, Dr. Ray.
Mahakikiri.
Yeah.
My question, Dr. Ray, because when they misdiagnose the gout, Dr. Ray, I know the gout medication is a very, very let's say, yes, harmful. Thank you. So because it can affect the kidney or the liver, huh? Because this is the reason why it's very important for doctors to diagnose the people correctly, because the medication gout can damage the kidney
Yes,
more than
and that's why a lot
treating the
of
gout.
people. That's why a lot of people here in Tonga, they heard from Dr. Overseas that you shouldn't take the gout medication.
Yes. And that's why, Dr. Ray, when I see people on Facebook asking for gout medication, like if you have some, and that is very sad because, now tonight, I seen some of this things that my husband go through. Now I realize many of them is not gout, but he has been taking gout medication for almost 30 years, and that's very sad,
Yeah, and you know what happened here with this, the cellulitis? The fingers swollen and the toes swollen, and once it's swollen, easy, the doctor said, it's gout.
Oh
See,
no.
Yeah,
to say
that's an
everything
easy
as well,
diagnosis gout, huh?
because the fingers is swollen and the toes swollen, and that's, you can even you can say, it's gout, because the toes and the fingers start to swollen in this area there, you can see.
Yes. I
And
bet ko lucky fa ilong ako ni Asia to pe ko no mo soma ku fula pe time ni vela ko time ko fula ko ni vela ta to fo itong a Brenda fa pe ta to ha ta ma ke ka ta hai ni o fa ilong ai o mahaki ko ko cellulitis ka ku fa lucky ta la pe to ta ya ko kauti ko nga ko ni fufula pe ane ko tangi rengi la tu ko ni ko age ha ta ma ke
Iyo. Ta koe mea pia kiri.
Oh yeah.
Iyo.
I have a long I go in mahaki we got cellulitis.
Iyo pa whapehe fukia o koe mahaki ko hange hanga tā maki koe kia no mata.
Oh yeah. Eta tole tonga.
Iyo.
okay,
You're good.
the last one, and it's very common,
Oh, stress.
stress fracture. This, it's very common. Even it can be, the doctor can say it's a gout. Why? What happened here? This is very common during your sleeping, or you walking, or you're running. Sometimes when you sleep, your hand bang on, like on the table next to the bed, or your foot bend the back side of the bed. That can cause little bit fracture in one of the very tiny bones in your foot, can cause swelling in the area and mamahi in walking, but you don't feel anything. It's just like pain where the area is. So this can be cause pain, swelling, aching inside of the fracture. It can cause very tiny fracture and can go with you whatever as you not treated. And this, you ask the patient, how this happened? Suddenly I was running and suddenly I get the pain and the doctor tell me it's gout. Or I was asleep and wake up with massive pain and swelling, went to the doctor, it's gout. You got it?
Yes.
Got it.
Mahaki ko ni ko misdiagnosed ko gauti ko stress fracture. Ay ko time ko fascia ho ki fasci iho ho tanga hui o mamahi pe fufula pe langa ai tafaaki ko fasci ko pangi fasci ki penia pe kwange ko time ko tenta ne sai Brenda ko hai time ko ke lava ke ala ia
Ala ia.
ke ala ko ke ia ku ange ko ku tape ku what's the word I'm trying to get ko time ko fai o ke ala ko ke lava ke ala ia ho to ponga to hui ko ia ka ko me ko pe to ta time ni ku te al kita lele pa te hau kita ku langa to vai ta lai ko kauti pe ku te mo pe kita pa te a kita ulanga to vai pa ta lai ko kauti ka ko kauti ai ko mahaki ko ni fa os ko ta lava ke ko tu pe ko stress pe ho ko fasi ka me fasi fangi fasi ne wi ki pe ia o ku ho ko pe ke ho tanga hui
Ne pehe e ia rini?
Ko
O
ia.
le pehe ia ko taim ko tau mohe ai. Sometimes tau kick o tau vai a stretch, hit
yeah.
a side of the bed, or
Yes.
fracture ho tau ki bone ho tau ki fracture ho tau ki vai without us knowing it. Because we're
Right, right.
sleeping. Yeah.
Yes, yes.
And then it caused this swelling, you know,
Ko ia.
area.
Mamo ni ta ia fa time po ni ia te mo kita pa te tau to vai kita me mo nga pa te a kita pongpongi ku hoka ki fasia pa tala ba ko kauti
Yes.
Ka pa time mo hoka ko fa ki fasi ko ni ko ka e ko fufula pe langa pe a ta fa
Yes.
aki ko o ki hui ko na fasi
You bet.
Back to
Yeah,
you,
but
Dr.
here,
Ray.
the patient here, because it's a very tiny fracture, we call it a stress fracture because it's a very tiny fracture. It's not caused the mamahilahi, but causes stress around the fracture.
Yeah.
So when patients start to walk or to use where the small fracture, he get pain. If he rests, saibe. If he starts, it will start to swell. I tell you, some people they have this stress fracture even for 10 years, 15 years, because it's a very tiny fracture of the bones, and because it's not be treated, it will be healed in wrong position of the anatomy of the foot or the hand, and every time you will walk you will have this type of swelling and pain because the little bone come to the side and being attached to the other bone in the wrong anatomy direction. You got it?
Yes. Hinga ko kuya ko stress fracture hay ko ki fast yan ya si au pito ya o ka ke loko ilonga ene mamahi na mo me ka ko pe ya ka foi me ni na hinga ko kya lave ka to I have a question for you, Dr. Ray. Can you use icing to be part of it to help with the stress fracture? Like you just put an ice on that foot or
Okay. Again, the camera to us.
okay.
Because
Okay, let me.
you ask me a very important questions, and that's gave me a headache here.
Okay.
You have 4 hours to 8 hours maximum to apply ice where
Okay.
the injured. After that, you need to apply warm water or warm stuff.
Okay.
Here, I have people, they was play sport like Iwa High School. They put ice. The following day, they still put ice. Who tell you that? Are we always? That's why you're still in pain and the pain will be worse and worse. We have a guideline. You apply ice when the injury starts till 4 hours to 8 hours maximum. After the 8 hours, you must apply warm.
Warm.
I'm glad.
Why we apply ice?
Okay, why to reduce the inflammation? Is that right?
Not to reduce the inflammation, to bleeding around the area.
Okay, reduce the bleeding around the area.
The bleeding going, that will be like swollen, that can cause inflammation.
Yeah.
Okay.
Yeah.
Yeah,
Yeah.
I'm very
Okay.
concerned. But what happened, when we put the ice, we do 2 things to reduce the message from the nerve to the brain, to the central nervous system to go back. Okay. Number 2, to block, to help the blood to be blocked, not to be circled. So if you have any bleeding, any internal bleeding will be stopped. But after 8 hours, now we apply the warm water,
water.
circulation, because if you continue put ice, you block the circulation. You block the circulation. Now it will be very worse. It will be like maybe green bruises, pinky, purple, black, because we need, you can't block, you need to do circle. So after 8 hours maximum, you need to apply warm where the injured to start to build up the circulation.
This is very important, Dr. Ray, and I want to translate it. because you know I asked the ice because that's how we always treat the gout for my husband. Kalau mereka dah ulai ke itu kita perintah, aku mahu ingat aku pita. Because aku time kau tapi halah ya, because tahu foto tui me apu kau ti. Aku memang tahu mai ke hawa pe fa ke hawa balu, itu apply ke IC Kaya
Koia.
mana osi peka kaya malu ngataha kaya hawa balu. Kaya osi peka hawa balu, pati hanga leva o fema o que te apply vai mama fana e ko
Koia.
ha o fema vai mama fana ke nga ke kamata ke circulate toto e ko tambo to ai ko ai si ta hanga da to bloka ai ha ko ni ai toto ta to
Koia.
bloka toto ai ko foi me ai ko apply ko ai si que de hanga o bloka e toto ke u ai toto covid ko de ko si hoko ko he
Io.
tempo te la ve ai
Bruised. Yeah.
Heko me ia ko taini mika kia te au o ko whaangau ek mo pe ice. You know, when we do the gout for my husband, Dr. Ray, we put ice today, we ice tomorrow, and then we keep icing every day. But now, this is very important that I learned this tonight, that the maximum you can do icing is like 8 hours and then just apply the warm water.
I will tell you a secret, and your husband, he will feel he's in the heaven. Okay? When he get the pain. But this is a very top secret. But everyone will do it.
But now everybody will know,
Okay. That's why if you remember the last health show, when I talk about the uric acid, I talk about the formula of the uric acid, which is C5, which is C, it's carbon. We have 5 carbon atoms, and we have hydrogen 4, and we have nitrogen 4, and we have O3. So to break this formula, get a pot, put warm water to cover the ankle, and put 3 tablespoons of kerosene.
3 tablespoons of what? Kerosene?
Yeah, kerosene. Go to the supermarket or to the petrol station and get kerosene. And put 3 tablespoons of kerosene to the warm water. Let him soak his foot for 15-20 minutes. Soak his hand, and if he have on his knee, what you do, get the mixture of the warm water and the kerosene and apply to his both knee, and watch out. The pain will be
Then put a match on top.
That's if she fight with him, she can put match.
Is that how you dissolve the uric acid right away, Dr. Ray?
Okay, I'll tell you. If you put kerosene with water and you try to put the matches, it will not. It will not be in.
Erase that. Remember,
but
it's
if
top
you
secret.
if you put the matches in the kerosene straight away, that will be fine. But when you mix the kerosene, because the chemical or the formula of the kerosene, when you 3 tablespoons, don't put more, because that will break the formula. So the formula of the kerosene mixing with the water, when you apply it with the formula for the uric acid, it will break it down. And you know, even if your husband still have the crystals or the muffy very hot, by he soaking his hand on or toes in the warm water and kerosene, within 1 week, the hard muffy, it will be very soft. Even it will be popped by itself, and all the muffy will be come outside like a puss.
Wow.
See?
Just for one time?
That's when we study.
And how often do you do that? One time on?
Do it every day for 10
how many days?
or 15 minutes, 20 minutes every day. And I'm telling you, within 1 week, even if his hand like bulk of muffy, it will become very soft.
What is muffy?
You know, stage 4.
Yeah, okay.
When I call too fussy,
Yeah,
like
too
Okay.
fast.
the toffee, the
Yeah,
toffee. So the
toffee.
toffee,
Toffee.
it will be very rigid. It will come soft, and I'm telling you, even it will be popped by itself.
Wow.
So it's a
Lovely.
The
1 cup.
only side effect of this one, the only side if this one, the side effect of this one, he will be smell like someone work in the petrol station.
But
That's
we
the
get
only
used
side
to
effect.
kerosene, Haline. We get used to
Yeah.
kerosene back home.
Yeah.
Yes.
Or other side, if you don't want to use kerosene, you can buy hydrogen peroxide 35%
Okay.
food grain. So if you don't want the kerosene, you can get hydrogen peroxide, but
Okay.
35%.
35%.
Don't get 7% because 7% it will not be the formula to break the uric acid. It
Yeah.
must be 35%.
Okay.
35?
Yeah.
It
Or
must be
hydro.
35%.
Okay.
Okay, because you have a lot of
And
hydrogen
how many?
peroxide.
Then how many you put in the? It's 3 tablespoons
Okay,
with the warm water.
no, you put 5
5
tablespoons of the hydrogen peroxide, 35%, because you have 7%, 30%. I don't care. It must be 35%. With
Okay.
the 35% here, it's food grain. You will see this mark, food, FOOD for Delta, grain. So what happened here? He soaked his food for 15 minutes, 20 minutes, and also he can have the drops. He can have 3 drops in a cup of water and drink. That will increase the oxygen in his body, increase the hydrogen in his body, and that will break the formula of the uric acid inside his body. So there is 3 things. If you use the hydrogen peroxide, okay, hydrogen peroxide, you can even up to 25 drops, but we don't do 25 drops. We start to put it gradually. Like we put 5 drops, 3 drops, then 4
Yeah.
drops, because the hydrogen peroxide, it will increase his energy. He will be full active. Like you feel like you charge him. That's the, because he will have more
Supercharger.
oxygen in his body. Yeah, I tell you,
Okay.
people even with asthma, we use hydrogen peroxide for them for 1 month, and the asthma will be gone forever.
Wow.
Wow.
Yeah. But hydrogen peroxide 35%,
35%.
because
Has
if
to
it's
be 35%.
5%, it will be poison. I'm telling you. So I'm very specific. Otherwise, people said, he said took hydrogen peroxide. No, we
Hydrogen
have to
peroxide,
defend it. The
35%.
only safe one is the 35%. But even with the 35%, don't touch it with your hand because it will burn your hand. You need to apply it to the water, then you drink.
So 3
Okay.
drops, eh?
We start with 3 drops and we can graduate to 8 drops. But I'm telling you, the formula of the hydrogen peroxide 35% food grain. This can be break the uric acid down and increase your energy.
I like the kerosene. Give me the 1 cup of warm water and 3 tablespoons of kerosene.
Yeah, 1 pot, you get the pot, fill it with warm water, and put the 3 tablespoons of kerosene, soak your foot and soak your hand.
Yeah.
And
I
even
like that.
Even if it's come to your knee, you can get the mixture of the water and the kerosene, apply it to your knee. And you know what? If you ask the patient, he will say, I feel like heat start to come from my hand to outside. Because of the reaction between the formula and the formula of the uric acid. We deal with chemical. You know, back days when the people, when the man working a lot and he feel like pain in his foot, they get water and Massima and they soak the foot, and he will feel okay. Yeah.
Right.
Yeah.
Yes. The masima. Right.
Yeah. Why here? Because we have the salt atmosphere outside our body, and that's make relaxation and build the circle in our foot. That's why we don't feel pain when we soak our foot in salty water,
Right.
because of the atmosphere. But I'm telling you, I'm taking the hydrogen peroxide 35%. It's very powerful. Even I'm telling you, people with cancer, if you do research for the hydrogen peroxide 35%, you will see how it's effective.
So, but how big is the warm water? It's just like 1 pot too, the warm water, and then you put the 5 tablespoons.
Yeah, warm water, and you put 5 tablespoons of hydrogen peroxide and soak the foot.
Hydrogen peroxide, right?
You
It
know,
has to be 35%. Okay.
you know, when you go to the what you call pedicure, when
Yeah.
you do pedicure,
Very
they
good.
actually
Pedicure.
yeah. Yeah, I don't know because I'm not a woman. So it's
Of course,
so what
Dr.
they
Ray.
do, they put hydrogen peroxide 7% in the water, and you soak your foot. So if you have any bacteria or any fungus or anything, it's easy, and make your nail to be very easy to cut,
Tough.
not rigid.
Right.
But that's the
Ah.
7%. Okay.
Right.
But when we talk about the 35%, is wow.
That's for the gout, huh?
Yeah.
Wow, so much to
Use,
absorb.
yes. Yes. And we're just going to leave that top secret formula without translating, because I'm pretty sure people will rewind this and listen to it so they can get it correctly, you know?
Yeah, don't translate the hydrogen peroxide
No,
one.
no.
Translate the kerosene one.
No, not that. Remember, it's supposed to be top secret. So we erased the
Okay.
top secret.
Leave it for the people understand English.
Yeah, yeah,
Yes.
Not to twist the word.
yeah.
Right,
Right.
right.
You
Okay,
got it.
that's awesome. That's
I
awesome,
wish that-
Dr. Ray.
I wish that I cover everything, and I wish
Yes.
that I answer questions to the people.
Very well.
Yes.
Very well.
Yeah.
And we do appreciate you come out.
Yes.
And I know your wife may be waiting for dinner for you, so
Yeah.
Yeah.
Late dinner.
Okay.
I'm gonna let
I
you
will
go
let
and have
you
your
know.
dinner and enjoy your dinner, Dr.
Oh,
Ray.
Fatu,
Okay.
Dr. Ray, malo hapito.
Oh, Fatulai, tomorrow the woman show, yeah?
Yes, yes.
Okay, I will see if Sisi can join you to the woman show.
Okay, okay. All right.
Yes. Thank you. Tell
And
her that
Ofatu.
tomorrow.
Ofatu.
Malo
Saife.
apito, saipe.
Iyo.
Malo.
Bye. Iyo.
Bye.
Sí, María, tú.
La vez del programa. Porque kapag dami que la bigay Brenda.
Ikay malo.
Ay, ako. Peke. Pega la leleta programa per metto che ta e fa finì che papia vai fiui per mo toki fa ho kumai per go out Emeline fa out monede from Seattle, Washington.
Brenda Kongaika.
Mo mea.
Avofa,